A 72-year-old woman suddenly develops left-sided weakness and an inability to speak. She has a history of hypertension and an irregular pulse. This clinical presentation points urgently to a stroke.
Mrs. Davies, can you smile for me? Try to lift both arms. Can you tell me your name?
Dr. Chen is quickly assessing for the signs of stroke using the critical fast mnemonic. She checks if Mrs. Davies's face is drooping, if she has arm weakness, and if there is speech difficulty. The T in FAST reminds us that time is of the essence to seek urgent medical care.
We need an urgent brain CT scan. This is most likely an ischemic stroke, but we must confirm before treatment.
According to the World Health Organization, a stroke is defined as the rapid onset of focal or global cerebral function disturbance with symptoms lasting 24 hours or more or leading to death with no apparent non-vascular cause. Strokes are broadly classified into two major types: ischemic stroke, caused by a blockage, and hemorrhagic stroke, caused by bleeding. We also consider transient ischemic attacks, or TIAs, as warning signs. Many factors can increase your risk of stroke. High blood pressure, type 2 diabetes, smoking, excessive alcohol consumption, obesity, and high cholesterol are all significant. An irregular heartbeat, known as atrial fibrillation, and a previous TIA or stroke also dramatically increase the risk. Upon arrival at the hospital, immediate management focuses on stabilizing ABCs, airway, breathing, and circulation. Oxygen is given if needed, blood glucose is checked, and blood pressure is closely monitored. The most critical step is an urgent brain CT scan. This scan is vital before any medication like aspirin is administered. Why? Because aspirin can worsen a hemorrhagic stroke, making early differentiation essential. For ischemic strokes, a treatment called thrombolysis, using drugs like alteplase, can be given. It's indicated for ischemic strokes within 4.5 hours of symptom onset, provided there's no bleeding seen on the CT scan. However, it's contraindicated in cases of hemorrhage, severe uncontrolled blood pressure, or recent surgery. Stroke can lead to various complications, including aspiration pneumonia, deep vein thrombosis, pressure sores, seizures, and even depression. But the journey doesn't end after the acute phase.
After discharge, secondary prevention is key. Medications like aspirin or clopidogrel and statins are prescribed. We also focus on strict control of blood pressure and diabetes, along with crucial lifestyle modifications to prevent another event.
Remember the key differences. An ischemic stroke often presents with a mild or absent headache, while a hemorrhagic stroke frequently causes a severe headache and vomiting. Crucially, a CT scan will show an infarct or no bleed in ischemic stroke, but definite bleeding in a hemorrhagic stroke.